else that's happening. Okay? So something else causes the patient to have anemia, which is what has to be determined what that cause is. Okay? So that is where the particular testing comes into play that actually tries to identify what the cause is and what could be causing that level to be low. Clinical manifestation. Let me say this to you guys. When it comes to, because there's so much information, when it comes to the testing, here's what I think you want to pay attention to. Okay? Number one, you've got to understand what the issue is or what the problem is. All right? You got to know what that means. Like if I'm talking about anemia, what does that mean? Okay? Then, manifestations. Manifestations are your signs and symptoms of that particular problem. So, because your questions are going to be formed in a way of relating to the information that I'm giving you, right? Then diagnostics. So, now we've identified what the problem is by diagnostics. So what are the diagnostics, the labs, the tests that's going to reflect really giving us a definitive diagnosis? Okay. Then after we've diagnosed it and we've looked at it, we know what it is, then how do we treat it? So you want to understand treatment. How is it treated? Medication, surgery, how is the particular problem dealt with and managed? Blood transfusions in this case, perhaps with the anemia, and then medications that's associated with it. You all have already had one, right? Pharmacology? So, that's one of those courses I'm saying to you. You got to bring that information with you. Just because you passed it doesn't mean you got it down. But it's important to start to appreciate and make connections. So taking those meds and connecting to the problem, are those meds appropriate to helping the patient? Because that's our ultimate goal, right? To help our patients. So, medication. Now, here's what NCLEX is doing now, if you're not familiar with it. NCLEX wants you to know generic names. In the past, they used to put both. Now they're only going to give you generic. So if I said to you LASIK, what is LASIK? Anyone knows what that is?
Furosemide.
Furosemide. That's what I'm talking about. Thank you, sir. Yes, that's what they're going to use. They're not going to put them both together. You're going to have to learn the generic name. All right? So that's what I'm talking about. So medications are going to be important because you need to understand what you're giving patients and is it working. Okay? Next is the side effects of those medications. I'm trying to help you understand what it is that I think is important for you to know and to try to learn, particularly when it comes to the testing. That's what I'm talking about. So side effects. So what would be a side effect of furosemide? What's that? She's right. Loss of potassium. So that means what? Then what is the reflection of that loss of potassium relating to your role? You need to be checking labs. Nobody should have to tell you, oh, you need to know what that potassium level is. Because maybe it's going to be you who goes to the physician and say, you know what, Dr. Smith, I can see that Mr. Jones's potassium level is low while receiving the furosemide. Do you think we should do something about that? Maybe maybe it's not so low, we can just have him have a banana. You know what I'm saying? Every morning with breakfast, they have to keep that level. That's the kind of that's critical thinking. That's what we're talking about. So, because you are the advocate for that patient. So you got to be thinking this stuff. So when we give you the knowledge, then we want you to apply it to a situation and do what's going to be best for the patient. Am I making sense? Correct. Then NCLEX is big on complications. They want you to understand what are complications associated with maybe the treatment or the disease process. So you can, if we treat the patient, you know, a big complication with the furosemide is, yes, the loss of, we don't want that patient to go into hypokalemia. And then potassium also affects what? Yeah, you see what I'm saying? So, complications. They want you to be aware of that. And then your role. With these questions, when you get the test questions, always ask yourself, what is my role in reference to that? What is it that I need to know and do for this patient to help them? And then the last one is teaching. They care about whether you're teaching the patient and the family and keeping them healthy and well. Okay? This is what I came up with. I think this is the, so when you're, just look at this book. It's huge. So when you're reading, read that kind of information that is going to bring you more knowledge in relation to the testing. Because we want to test and know that you know this information and you know what to do for a patient when it comes to it. All right? So the hemoglobin. So we talked about the age and age in American. Now you're going to look that up because it's different for men and women, right? And you're going to start to learn the ranges so that you'll know those levels are reflective of, yes, anemia. And then here it is. And there's such a thing as mild and severe cases of anemia. All right? And when someone is anemic, it's important to know what their level is, because how low is it? How low is it? What is your concern in reference to that? You should be thinking safety. Why? Why am I saying safety is such a concern with someone who's anemic? Yeah, very good. If they're weak, they can fall. You don't ever want a patient to fall on you. You will feel bad. So, if you know, critical thinking, that the patient's levels are low and they are at risk for falling, you got to go to them proactively and say, listen, Mr. Jones, your blood levels, now don't go using terms like anemia, they're not going to know what that means. You got to use layman's terms. And so your blood levels are low. I'm concerned, and then ask them, do you feel weak? Because they might say, yeah, I feel kind of tired and weak. Well, that's good. Well, here's what I want you to do. I don't want you getting up by yourself. I want you to call me so that we can help you if you need to get up to go to the bathroom, the restroom. You see what I'm saying? That's the critical thinking ahead, and thinking proactively for your patient. All right. So you could get questions that relate to that. Now, manifestations. Well, we just talked about the levels of the results. You're going to check those. The patient will probably look paler. They're going to look tired. They're going to look anemic. You should be looking at them. They may have jaundice where their bilirubin is elevated. And then itching, believe it or not, pruritus, which is a reflection of the bile salts. Okay? Cardiopulmonary manifestations that are reflective of anemia. can it also affect the lungs, and then there's not adequate blood flow, of course, to the body, and so then the patient has a decreased cardiac output, which we're going to talk about when I talk about cardiovascular, which is going to make sense as well. Okay? And then with that, of course, there's the potential for heart failure. Now, you won't get heart failure specifically in this course. That's going to be measured to get specific elements of heart failure. And so, subjective information. So I started to mention that a little bit earlier. You've got to ask that patient some information to have a better understanding where they are, and you're going to be looking at their history, their medication, surgery. All of that is going to help you understand the particular aspect of anemia for the patient. Objective, again, that's on your part. You've got to do your assessment that matches that. So you're going to look at labs, you're going to have your assessment, you're going to have subjective, objective information. You're going to get all of that before you call the doctor. You don't just look at them and say, oh, I think they're anemia. I better call the doctor. You've got to have some facts. Fatigue. They could be tired, like I said. So that could be a nursing diagnosis. Ineffective self-management and management. The major patient is not going to be able to manage themselves in their own home. Maybe they're going to need some assistance. Okay? Is there a family member that can help them? Altered breast, this just gives you some interventions that take care of yourself. Patients with fatigue. So we want to make sure that they're getting altered rest and activity. That's going to be your responsibility. So prioritize their activity. Okay? Maybe they get up in the morning, do their ADLs, but maybe they need to rest now, and then get up for PT later. All right? So numerous causes. We just talked about that earlier. Numerous causes of anemia. So patient-specific needs. So we got to look at the patient specifically, but that's why you do your assessment and you gather information. Now, case study. Let's look at this. Male was 24 years old with complaints of increased lethargy, inability to pay attention at work, a headache, has a pale, easy tone, and inflamed gut. She tells you she is breastfeeding her 4-month-old. What should you do at this point? Based on what we talked about earlier, and based on what you just this case here, what should you do? What's that? Blood work. That's going to have to be done. But you don't just do that. You got to have a doctor's order. What's that? Again, if it's order.
Nutrition.
Think about that when you're answering questions. Because if it's something that's not in your scope of practice,
health history?
Her question is, well, what about over the counter? We need to have a better understanding. What's that? Yeah, we need to have a better understanding about what's going on before we can treat. Okay? So we got to have a better understanding about what's going on. So that is what goes back to what I said earlier. You got to do your thorough assessment. You got to, kind of come up with some elements about what might be. So you're going to ask her a question about her nutrition. What are you eating? What are you taking? So that comes back to assessing whether she is taking supplements over. Because sometimes you want to be careful about patients taking over-the-counter medication. So, for good. So that's going to be, and then she says that, what? She didn't say what the child is. Well, she has a 4-month-old. So I'm thinking about that because a 4-month-old means she recently delivered. So she could have lost blood. Exactly. So that's the critical element. So I probably would actually, after doing my assessment and determine a little bit about, I might want her just not to be so involved yet, so we have a true understanding about what's happening. So the assessment, that's what you can do, is get a thorough assessment, both subjectively and objectively. Okay? So I might ask her, well, exactly when did you deliver? Did you have any problems when you delivered? Gerontological considerations. We always want to look at our elderly. So what is something, did you know that with the elderly, it's because it's age-related, their hematocrit, their H&H will automatically be low. It's just because it's related to the aging process. So they're going to already be low just due to age. But if you add anemia on top of that secondarily, that makes them weaker. You see, even at a greater risk. So think about those things when you are saying someone is anemic. Look at their age as well. Okay. And some people say may be mistaken for normal aging. So we want to look at that. Let's see. Next slide. Yeah, we talked about erythropoietin, your EPO. Okay. Primarily produced in the glycoprotein. That's produced in the kidney. Okay. 10% in the liver. The increased number of stem cells committed to RBC production. So we want to look at that aspect. Erythrocyte. Now, let me make sure I follow my list here. So I said 2 to 14, 16 through 23. Okay. Now, I'm not going to ask you, like this lifespan of RBCs. I'm not going to ask you that. That's just, I don't think that's relevant, even though that's here. But I wanted you to understand that erythropoietin may decrease the production. So that's the aspect that I'm wanting you to appreciate today. Let's look at iron deficiency anemia. So we're looking at the different types of anemia. The most common nutritional disorder. So if we're looking at iron deficiency anemia, we want to consider the nutrition. So that's going to be very important to get an assessment and understanding of that patient's nutritional habits. So what I might do is ask that person to give me a breakdown of their nutrition in a 24-hour period, so I can get some understanding about that. Okay. The most susceptible to this are you're very young and you're people with poor diet, women in reproductive years. Okay, so those are the most susceptible to iron deficiency anemia. Inadequate dietary, 5 to 10% of ingested iron is absorbed. So there could be a problem with malabsorption of iron. And maybe that's the problem. They're not absorbing it appropriately, and that is where the problem lies. And that's going to have to be looked at in terms of products by the physician on a larger scale. Okay, that we can treat that patient appropriately. But other diseases or surgery itself can cause people to have malabsorption. So you don't have to know that, but you do understand that blood loss can contribute just in general. Maybe someone has surgery and they have, or a mom pregnant delivers and lost a lot of blood. So, and then hemolysis can play a point in terms of blood loss. So anemia can occur. Anemia can occur in a number. That is why I said earlier, it's primarily secondary to something else that causes. General manifestations, of course, it's going to be paler as well. Osteotype, glycogen is a secondary inflammatory of the tongue with someone who has iron deficiency. And then look at the lip. So we talked about kind of the lip being red. Okay. We want to look at that as well in terms of iron deficiency. So you want to look at what are the, also, if labs have been drawn, what are the iron levels? Go and look at the ferritin. Look at those levels to determine how low are they. Lab, this is what I'm saying here. So also look at the bilirubin, your platelet count, your H&H. So look at this here. Look at your differentiation that relates to these. Stool, also blood test. That's where they test your stool to see if there's bleeding in the stool. If you're bleeding internally, okay. Endoscopy and then colonoscopy. So these are some of the particular diagnostic studies to look at and trying to get a definitive diagnosis of iron deficiency anemia. Colonoscopy. When should the first colonoscopy be done? 50. Very good. And then what is the routine after that? Every 10 years. Unless you have a point, unless there is a history. Maybe the person has a history of polyps or there's a family history of some sort of problem that causes them to want to look at that person more frequently. So you're right too. Okay. Interprofessional. So now that's the theme today. We treat patients interprofessionally. We look at the team approach. So it's not just one person. So the goal is to find out what is the underlying, and then replace that iron either through nutrition, through oral iron, or transfusion of packed red blood cells. What's important for you to teach a patient you think that's taking iron? Anyone? Yes, sir.
Might cause constipation.
Exactly.
Might make their food brown or green.
Very hard. Yeah, that's good. Very good.
Take it in between meals.
Yeah,
take it in between meals.
Yes. Yeah, very good.
Anything with vitamin
Take it with orange juice. Why?
Vitamin C. Increases absorption.
Very good. And then we also want them to use a straw. You don't want to use a
Use a straw.
So this is good. I'm glad to hear you guys say these things because you need to know these things. You're going to get questions that reflect a situation, and then do you have the knowledge to be able to know what to tell them? Okay. Very good. So she's been diagnosed with iron deficiency anemia. Okay, her blood work labs were done. So you can see H&H is low, the MCV, her iron, the ferritin, the transfer, all of that is low. Her TIBC is elevated. So what is the likely cause of her anemia?
Iron deficiency.
Yes.